Welcome to everyone to our third BC Stroke Strategy telelearning session on the GPAC guideline on the management and prevention of stroke TIA. I'm Mark Carlson. I'm the Director of Advocacy for the Heart and Stroke Foundation and the co-chair of the BC Stroke Strategy. I'll be the moderator of this session, which is really the role that probably prays the hardest that all the technology works and everybody can see the slides and hear us. Just a quick plug for the BC Stroke Strategy. If you don't know who we are or what we're up to, please visit our website, bcstrokestrategy.ca, to find out more. Just a few reminders and housekeeping items before we start. Please mute your microphones and telephones if you haven't done so already. For physicians in attendance, as the session has been accredited by the Canadian and the BC College of Family Practice, please sign the attendance sheet at your site to help facilitate the CME process. If there isn't a sheet, you will need to get someone at the site to make up one with names and email addresses, and we'll give you a fax number to send that to after the session. The session has been accredited for 1a.mp4 M1 credit. Your site may or may not have copies of the CME certificate there. If not, please sign the attendance sheet with your email and address, and we will get one to you. They're also available on the BC Stroke Strategy website. And at the end of the session, these attendance sheets need to be faxed to 1-250-595-8074, and I'll repeat that again at the end of the session. Okay, so let's get on with the main event. We're honored to have Drs. Ron Warnerbolt and Dr. Phil Teal join us from the Vancouver General site to present on the GPAC guideline on stroke and TIA management. Dr. Warnerbolt is currently a clinical associate professor of family practice at UBC. He has been a member of GPAC since 2005, a member of the E-Drug Do Task Group since 2007, and an assessor investigator for the College of Physicians and Surgeons of BC since 2000. Ron was the chair of the working group that developed the GPAC stroke and TIA guideline. Dr. Teal is also a clinical professor at UBC and is an internationally recognized stroke expert. He is the director of the Vancouver Hospital and Health Services Centre for the Stroke Program, chair of the Canadian Stroke Consortium, and a board member of the Canadian Stroke Strategy. His clinical focus includes stroke prevention, acute stroke management, neuroprotection strategies, and planning and organizing and managing clinical trials. Additionally, Dr. Teal is a member of our BC Stroke Strategy Steering Committee and is the lead of our Telestroke Working Group. So without further ado, I am going to hand it over to the doctors, and over to you. Thank you.
Thank you, Mark. Thank you for those kind words. And thank you to the BC Heart and Stroke Foundation for all of their work that they're doing now with heart and stroke. Through the Canadian Stroke Strategy and the BC Stroke Strategy, they have been instrumental in lobbying for funding and for resources for TIA and stroke management and diagnosis, and of course also for patient education. So it's very much appreciated. I must say I'm very impressed with their work. I'm going to give you a little introduction to the talk. I'm going to speak for about 15 minutes and then turn it over to Dr. Teal. And I'm going to talk about the importance of diagnosing and managing transient ischemic attacks, or TIAs. Our presentation will last about 35 minutes. And what we are going to try and have you take home is 7 key recommendations from the guideline that was produced by GPAC, the Guideline and Advisory Committee. That is a joint committee of the BC Medical Association and the Ministry of Health, and it has produced over 50 guidelines, and they are available online. I would encourage you to go online and have a look at them, but particularly to have a look at the stroke guideline. The guideline itself is 6 pages long, so it's not overly arduous to go through it. We've tried to keep it very brief. There is also a 2-page summary article, and there are appendices which I think you would find very useful. So, stroke and TIA. There have been new technologies and evidence-based studies in the last few years that have absolutely revolutionized the treatment of transient ischemic attacks and of strokes. Strokes are a major cause of death and disability in BC, and in fact, in the fiscal year 2008-2009, there were almost 7,700 strokes in BC. To put it another way, in Canada, that would mean there is 1 stroke every 10 minutes, which is quite amazing. Rapid assessment and treatment is critical to reducing the disability and the mortality from both transient ischemic attacks, but especially from strokes. We'll have a couple of definitions, just so you're all on the same page. A transient ischemic attack is a brief, reversible episode of neurologic dysfunction, and it's usually due to a lack of oxygen supply to an area of the brain. That's called ischemia. A TIA can last from minutes to an hour, and sometimes as long as 24 hours. And the symptoms usually include a transient loss of speech, a motor or sensory loss to one side of the body, vision loss, or sudden coordination difficulties. The onset is usually quite rapid, where the resolution can be much more gradual. And the diagnostic code appears on this slide because we want all physicians using and seeing patients with TIAs, we encourage them to use that diagnostic code because that is going to allow for accurate statistics and for tracking of strokes and TIA, and hopefully will result in more adequate resources being put into the field for TIA and stroke care. The differential diagnosis for TIA has to include a stroke, but also includes these four common differentials: seizures, a migraine with aura, syncope or vertigo due to a peripheral vestibulopathy. These are often called TIA mimics, and if a patient was attending a TIA clinic or a stroke clinic, these TIA mimics would make up about 40% on the average of the diagnoses. They're very important to keep in mind. Stroke is also the sudden onset of focal neurological deficit resulting from infarction or hemorrhage within the brain. So it's similar in symptoms to a TIA, but the symptoms are not temporary. And you can see the diagnostic code there. This is a useful slide just to indicate in acute stroke that 85% of the strokes are ischemic and 15% are hemorrhagic. And if you break down the ischemic strokes even further, 80% are due to cerebrovascular disease and 15% are cardiogenic. And though those cardiogenic, that includes atrial fibrillation, that includes some ischemic heart disease, but valvular heart disease and infective endocarditis. And it's interesting to note that those strokes due to cardiogenic sources are often more severe. The differential diagnosis for stroke is large. You'll notice that it includes the same four items that were under TIA: seizure, migraine, peripheral vertigo, and syncope, but you also have to consider many other diagnoses, including brain tumor and subdural hematoma, vasculitis, drug side effects, transient global amnesia, infective sources like encephalitis, functional disorders, delirium, and you must consider the paroxysmal presentation of other neurological disorders, of which there are just four examples there, such as multiple sclerosis and upper cord lesions, radiculopathies, acute peripheral neuropathies, amongst the diagnoses.